Hi, I'm Katie, and today I'm going to be talking about restrictive anorexia nervosa. This is going to be a very quick presentation just because I'm trying to keep all this information under 4 minutes. So let's get started. So, what is anorexia nervosa? It is an eating disorder that involves severe calorie restriction, often a very low body weight. It's a complex condition that has mental, behavioral, and physical symptoms, which we're all going to go into. So what causes it? Again, there's three main categories that kind of bring this all together. So we've got biological, psychological, and then social. Components. So biologically, we're looking at genetics and brain chemistry. If you've got a family history of this, it might be a little bit more likely that you'll develop it. Psychologically, we've got low self-esteem, perfectionism, depression, anxiety, a need for control. Again, this is all very general. There's a lot of psychological things that go into it, but I'm just listing a few for the sake of the presentation. And then socially, we're looking at family and friends and cultural pressure. And then specifically, I wanted to mention societal pressure, especially from the media, as that's a lot more prevalent these days than it was, maybe 30 years ago. So that's definitely something to keep in mind. So moving on, what does it look like? How does it present? So a lot of physical symptoms are kind of what we see first. So it's that extreme weight loss, the fatigue, dizziness, hair loss, irregular heart rate, the persistent cold feeling, not being able to warm up. And then for women, absent or irregular periods. Behaviorally, we're looking at that food obsession. That's the kind of the trademark of anorexia nervosa. We've got the extreme dieting and the over exercising, and a lot of times skipping meals can be a part of that as well. And then emotionally, there's that intense fear of weight gain, and then distorted body image, where you're thinking like a person with anorexia is thinking, oh my gosh, I look so much bigger than they are in reality. And it's triggering them to continue cutting calories and going down that path. So what happens? What are the health consequences? We're looking at malnutrition, which is a really big one, a weakened immune system. So people are getting sick more often, and the sicknesses will take them out for longer than a healthy individual. Organ damage, specifically your heart and your kidneys, are going to take a very direct hit. Hormonal changes, depression, and anxiety, all of which can develop. Again, it's not all or none. It varies based on the person. So because this class is a lot of future healthcare professionals, diagnosis-wise, there needs to be a physical exam as well as a psychological exam, because this condition does affect both. Both of them have to happen for a diagnosis. Treatment-wise, we're looking at nutrition counseling, medical monitoring, psychotherapy, and then there's sometimes medication, as well as some inpatient centers. Awareness-wise, sorry, I'm really speeding through here. What can we do? So we can encourage open conversations about mental health, and that kind of goes along with educating people around you. The more we talk about it, the less stigma there is, and the more likely people are to, get the help that they need in this kind of thing, even though that is a bit more of a difficult situation, especially with eating disorders. And then what you might not realize, this is just very quickly, so anorexia affects both men and women, although women are typically people associate it more with women. They have the second highest mortality rate of any psychiatric illness, second to, I believe, opiate addiction. And then someone dies as a direct consequence of an eating disorder every 52 minutes, which is really a crazy thing when you think about it. And then last but not least, less than 6% of people with an eating disorder are clinically underweight, which I think is an incredibly important point to make. So somebody might lose a lot of weight very quickly, and it's seen as, oh my gosh, this is great job, like losing weight, like you look so healthy, but it's actually very unhealthy if you're not losing the weight in a healthy way. So yeah, I just wanted to go over that quickly, and then here are my works cited. Thank you so much for listening.